You used to have energy that could light up a room, but lately, you're tired all the time, forgetting names, feeling off balance. Is it just aging, or is something else going on? If you're over 60 or caring for someone who is, you know the body starts to change, and not always in ways we expect. But what if I told you one simple, often missed vitamin could be the key to getting your strength, memory, and spark back? In today's video, we're diving into something that affects millions of older adults in the US, but is still rarely talked about at regular checkups: vitamin B12 deficiency. And trust me, it's more common, more serious, and more treatable than you might think. So let's start with what makes this issue such a hidden danger for aging adults and why it matters more than most people realize. Have you ever found yourself thinking, why am I so tired lately? Or is it just age, or is something more going on? If so, you're not alone, and you may be asking the exact question that could change your health for the better. Vitamin B12 deficiency is a surprisingly common yet often overlooked issue among older adults. As we get older, our bodies go through subtle changes that can significantly affect how we absorb and use nutrients. One of the most important of these is vitamin B12, a key player in keeping our red blood cells healthy and our nerves functioning properly. Here's the startling truth. Studies have shown that anywhere from 3% to over 40% of adults over age 60 in the US may be experiencing some level of B12 deficiency. That's not a small number, and the consequences are anything but minor. B12 deficiency can lead to anemia, chronic fatigue, memory problems, walking difficulties, and even symptoms that mimic dementia. Over time, if left untreated, it can contribute to irreversible nerve damage and a significant loss of independence. Yet despite how serious it can be, B12 deficiency is often missed in routine healthcare. Why? Because the symptoms tend to creep in gradually. You may feel just a little more tired, or notice a bit more forgetfulness, or feel slightly unsteady on your feet. These slow, subtle changes are easy to write off as just getting older, and unfortunately, that's exactly what often happens. Consider Tom, a 73-year-old retired electrician from Minnesota. He was always active, but over the course of a year, he started feeling foggy and worn out. His daughter noticed he was repeating himself more and stumbling when he walked. It wasn't until he saw a specialist and had his B12 levels tested that they discovered a severe deficiency. Within weeks of starting treatment, Tom's energy improved and his mental sharpness returned. This is exactly why we need to talk about B12. It's common, it's serious, but it's also very treatable. And being informed might just help you catch a silent issue before it turns into something life-altering. In the next section, we'll look deeper into what vitamin B12 actually does in your body and why aging makes it harder to get enough of it, even if you're eating well. Have you, or someone you know, ever experienced unexplained fatigue, balance issues, or brain fog? Share your thoughts or questions in the comments below. Your story could help someone else feel less alone. Have you ever wondered how your body could be eating the right foods and still be missing something important? That's exactly what can happen with vitamin B12 as we age. The problem isn't always about what we eat. Sometimes it's about what our bodies can no longer absorb. Vitamin B12 is a unique nutrient. Unlike many vitamins that absorb fairly easily, B12 requires a multi-step process that depends on healthy stomach acid and a special protein called intrinsic factor to be absorbed properly. As we get older, the stomach produces less acid and less of this crucial protein. This condition, known as atrophic gastritis, affects up to 20% of people over age 60, and it silently limits their ability to get enough B12, even if their diet includes meat, dairy, or eggs. But the story doesn't stop there. Common medications can also interfere with absorption. Drugs like Prilosec, Nexium, and Pepcid, all used to treat heartburn or reflux, lower stomach acid, making it harder for the body to extract B12 from food. These medications are widely prescribed and often used for years. Another major culprit, Metformin, one of the most prescribed drugs for type 2 diabetes. It's effective and generally well tolerated, but long-term use has been shown to reduce B12 levels. Unfortunately, routine monitoring isn't always done, and deficiencies can creep up undetected. Chronic alcohol use, gastrointestinal surgeries like gastric bypass or colon resection, and conditions like Crohn's disease or celiac disease also interfere with absorption. The result? Your B12 levels can drop slowly, year after year, without you even knowing it. Take Linda, a 68-year-old retired nurse from Boise, Idaho. She stayed active, ate a healthy diet, and took pride in managing her type 2 diabetes with Metformin. But over time, she began to feel foggy, with occasional numbness in her hands. At first, her doctor chalked it up to aging, but when a new provider checked her B12 level and followed up with a methylmalonic acid test, it confirmed what her body had been trying to say. She was deficient. Within a few months of treatment, her clarity and energy returned. Stories like Linda's remind us that deficiency isn't always about eating poorly. Sometimes, it's the result of internal changes or medications we rely on every day. In the next section, we'll explore the specific symptoms of B12 deficiency and why they can be so easy to miss until it's too late. Have you or someone in your family ever experienced unexplained fatigue or nerve symptoms while taking long-term medications? Share your experience in the comments. It might help others feel seen and supported. Have you ever blamed your fatigue, memory lapses, or clumsy balance on simply getting older without asking if something deeper might be going on? That's the trap many older adults fall into when it comes to vitamin B12 deficiency. Its symptoms can be subtle at first, but over time, they can mimic far more serious conditions like dementia, neuropathy, or chronic depression. The key to recognizing B12 deficiency is knowing how it touches multiple systems in the body and how easily it can be misinterpreted. One of the earliest and most common signs is anemia. When your body doesn't get enough B12, it struggles to make healthy red blood cells. You might feel worn out, short of breath, or weak, even after a full night's rest. Unlike iron deficiency anemia, where red blood cells shrink, B12 deficiency leads to larger than normal cells, a condition called macrocytic anemia. Then there's what it does to your nerves. B12 plays a critical role in protecting the myelin sheath that surrounds your nerves. When that protective layer wears down, you may begin to feel tingling, numbness, burning sensations, or even muscle weakness. It often starts in the hands or feet, but can progress to more serious balance issues and difficulty walking. And then come the cognitive changes. Low B12 levels can affect memory, focus, and mental clarity. Some people report feeling off, forgetful, or confused. Others feel irritable or emotionally flat. In some cases, these changes are mistaken for early-stage Alzheimer's or depression, when really, the brain is just starved for B12. Take Patricia, a 76-year-old retired accountant from Sacramento. Her family noticed she was repeating stories, misplacing her phone, and having more trouble with stairs. Her doctor initially suggested a cognitive screening, but her daughter requested a B12 test as well, just to rule it out. Sure enough, her B12 level was 230, technically low normal, but still problematic. A follow-up test measuring methylmalonic acid confirmed a deficiency. 3 months into treatment, Patricia was sharper, steadier, and even back to doing her morning crossword puzzle. The tricky part: you might not feel all the symptoms at once, or they may come and go, making it even harder to pinpoint. That's why it's so important to stay alert and trust your instincts. If you feel that something isn't right, even if lab results are borderline, it's worth digging deeper. In the next section, we'll talk about why B12 deficiency is so frequently missed, even by well-meaning doctors, and what you can do to make sure it doesn't slip through the cracks. Have you ever been told your symptoms were just aging, only to discover there was a treatable cause? Share your story or questions in the comments below. Your insight could help others advocate for themselves too. Have you ever felt like something was off with your health, but were told, "That's just part of getting older"? That single phrase has delayed more diagnoses than we can count. When it comes to vitamin B12 deficiency, this assumption can be particularly dangerous. One of the biggest reasons B12 deficiency is missed is because the symptoms develop slowly and mimic the natural aging process. Fatigue, brain fog, balance problems, memory slips, they often show up so gradually that neither the patient nor their doctor realizes something treatable might be at play. Instead, it's chalked up to normal aging, but aging doesn't mean your health concerns should be dismissed. There's another wrinkle: even when doctors do check B12 levels, they might stop short. Many older adults have B12 results that fall into the low normal range, usually between 200 and 400 pg/ml. That might seem acceptable on paper, but for some people, those levels are already too low for the brain and nerves to function properly. Unless the provider knows to dig deeper, the problem goes unresolved. This is where a follow-up test like methylmalonic acid, MMA, becomes so valuable. MMA builds up in the body when B12 is low, and high levels can reveal a deficiency that basic blood work doesn't catch. Sadly, unless patients or caregivers ask for it, this second test often isn't ordered. Let's look at Marie, a 75-year-old retired music teacher from Asheville, North Carolina. She started feeling off slower, more forgetful, and a little wobbly on her feet. Her doctor ran standard labs and told her everything looked fine, but Marie's daughter pushed for more answers. A B12 test came back at 270 pg/ml, technically in the low normal range. A follow-up MMA test confirmed a true deficiency. Within a few months of treatment, Marie felt steadier, sharper, and more like herself. Marie's story is one of many. In truth, ageism in healthcare often plays a quiet role. Too often, symptoms in older adults are minimized or written off as inevitable. But being over 60 doesn't mean you should accept foggy thinking or declining mobility without investigation. The takeaway? If something doesn't feel right, ask questions. If you're told everything looks normal but you still feel off, consider asking for a B12 check and, if needed, an MMA test. You have the right to advocate for clarity. In the next part, we'll talk about exactly who should be tested for B12 deficiency and how to know when it's time to speak up. Have you ever had a gut feeling that something was being missed in your care or a loved one's? What helped you push for answers? Let us know in the comments below. Have you ever felt like something just isn't right with your body, but no one has suggested looking deeper? That's often the case with vitamin B12 deficiency. It doesn't always wave a red flag. Instead, it shows up quietly, in ways that can be mistaken for stress, aging, or just getting older. So who should actually be tested for B12 deficiency? The answer: anyone experiencing symptoms that might be related, or anyone who has certain risk factors that affect B12 levels. Let's start with symptoms. If you're feeling unusually tired, experiencing numbness or tingling in your hands or feet, dealing with brain fog, memory slips, or struggling with balance, it's worth getting checked. These aren't just minor inconveniences, they could be signs your body isn't getting what it needs to function properly. Take David, a 67-year-old retired firefighter from Spokane, Washington. Strong, active, and never one to complain. He began to notice that climbing stairs left him winded, and he started stumbling on morning walks. His doctor originally attributed it to aging, but David had been taking Metformin for over a decade. A blood test revealed a B12 level just above the low threshold. With treatment, David's stamina returned, and he told his wife, "I feel like myself again." David's experience is a powerful reminder. You don't have to wait for something serious to take action. Testing is easy, treatment is low cost and safe, and catching a deficiency early can help prevent long-term damage. In the next section, we'll talk about exactly how B12 deficiency is diagnosed and what tests matter most. Have you ever had symptoms dismissed, only to find out later there was more going on? Or do you take medications that you now realize might affect your B12? Share your thoughts in the comments. Your story could encourage someone else to speak up too. If something simple could help you feel clearer, steadier, and more energized, would you do it? That's the beauty of treating vitamin B12 deficiency. Once it's identified, the solution is usually fast, affordable, and highly effective. The key is choosing the treatment method that works best for you. There are two main ways to restore low B12 levels. High-dose oral supplements, usually 1,000 to 2,000 micrograms daily. Intramuscular B12 injections, typically given weekly at first, then monthly for maintenance. For a long time, injections were the go-to option, especially for older adults or those with poor absorption. But newer research has shown that oral B12, when taken consistently in high doses, works just as well in most cases. Even if your stomach struggles to absorb B12 the traditional way, your body still absorbs a small percentage through passive diffusion. That means taking 1,000 to 2,000 micrograms per day ensures enough B12 slips through to be therapeutic. Still, Injections may be preferred in certain situations. If your symptoms are severe or worsening quickly, if you've had trouble remembering to take pills, if you prefer a set it and forget it monthly option. Let's meet June, a 70-year-old retired librarian from Atlanta. She had been feeling increasingly foggy, even forgetting names of close friends. Her doctor diagnosed a B12 deficiency and prescribed daily tablets, but June kept forgetting to take them. Her daughter suggested switching to monthly injections. Within weeks, June said she could feel the fog lifting. Her confidence returned, and she even started attending her book club again. Many people start noticing improvements within 2 to 4 weeks. Energy levels rise first. If anemia was present, red blood cell counts typically recover in a month or 2. Neurological symptoms like numbness, poor balance, or cognitive issues may take longer, sometimes several months to fully improve. In most cases, treatment continues long-term, especially if the underlying cause of the deficiency hasn't gone away. Some people stay on monthly injections indefinitely. Others switch from injections to oral supplements once their levels stabilize. And here's some peace of mind. You can't overdose on B12. It's water-soluble, which means your body uses what it needs and eliminates the rest. In the next part, we'll look at how to prevent B12 deficiency before it even starts, especially if you're at risk. Have you or a loved one tried B12 injections or supplements? What changes did you notice, and how quickly? We'd love to hear your experience below. What if one small daily habit could help you stay sharper, steadier, and more independent as you age? The good news is, it can. Preventing vitamin B12 deficiency is not only possible, it's often incredibly simple. For many older adults, a daily B12 supplement can be the difference between quietly declining and continuing to thrive. If you're over 60, the odds of developing a B12 deficiency increase naturally. Even with a balanced diet, your body may absorb less due to age-related changes in stomach acid and enzyme production. Add in common medications like Metformin or acid reducers Prilosec, Nexium, Pepcid, and your risk goes up even more. That's why many healthcare professionals now recommend preventive B12 supplementation, especially for those in higher risk groups. A daily dose of 90 micrograms is usually safe, effective, and widely available over the counter. Some older adults prefer standalone B12 tablets, while others use multivitamins that include B12 and other nutrients. Look for reputable brands, and always check labels for dosage. Even a product like Centrum Silver can provide solid support, though some people opt for higher quality formulations like Thorne or Pure encapsulations depending on their needs. Take Hank, a 66-year-old retired mechanic from Kansas City. He watched his older brother struggle with cognitive issues linked to low B12. So Hank decided to be proactive. He added a high-dose B12 lozenge to his morning routine. At his next physical, his levels were right where they needed to be. More importantly, Hank felt focused, energized, and confident, knowing he was taking charge of his health. Beyond B12 alone, there's growing interest in how B vitamins overall, including folate and B6, may help lower homocysteine, a compound linked to heart disease and cognitive decline. While research is ongoing, taking a high-quality multivitamin may offer additional benefits, especially when paired with regular checkups and a balanced lifestyle. Bottom line, prevention is easier than treatment. If you have risk factors or simply want to protect your energy, memory, and mobility, consider making B12 part of your daily wellness plan. Have you already added B12 to your routine, or are you thinking about it now? Share what you're doing to stay sharp and healthy. Your habits might inspire someone else to start today.